Hi, everyone, and welcome to another episode of Health Unfiltered. Now, pregnancy is a very unique period for most mothers, but also it's a period that makes the woman face a lot of risks and complications. And today, we would like to just discuss about the possible complications that can occur during a pregnancy and during the time of childbirth. It's helpful because when you know the complications, it helps you to really make sure that you prepare and you prevent such complications from happening. But also, it helps in terms of interventions so that timely interventions are undertaken. Now, the commonest complications during pregnancy uh, or underlying medical conditions, for example, what we call preeclampsia. Preeclampsia is simply a state or a condition where your blood pressures raise in pregnancy. Now, your body is able to control blood pressure normally. However, if there is a problem during the time of placenta formation, especially for the first 4 to 5 months, then your baby is going to, or the placenta is going to release chemicals to the mother's body. And these chemicals are the ones that are responsible for causing the damage of the blood vessels and triggering the onset of raised blood pressure. So, depending on how the placenta has attached, that will also determine how quick this mother is going to develop preeclampsia. So, how do you tell that you could be having preeclampsia or a raised blood pressure in pregnancy? So, most of these mothers don't really feel any symptoms. If anything, we discover that they have raised blood pressures when they come for antenatal. So, it's really recommended that the place you go for antenatal should be able to take your blood pressure. Do not leave an antenatal visit when your blood pressure has not been recorded, because then the the early signs or the early interventions would be missed. But over time, as the blood pressure starts rising, this blood pressure can actually affect organs or what we call vital organs in the body. It could affect the brain, and that could present with things like a headache that is not responding to most of the painkillers. It could also affect your vision. So you may have double or blurred vision, or even you could be able to see flashy lights or spots during your vision. And this blood pressure can also present with things like dizziness. You may have a bit of pain around the chest area, what we call the epigastric area. And this pain sometimes mimics ulcer like pain. So sometimes it's possible for the mother to confuse the chest pain with ulcer like pains. And when you go to a place that is not well equipped, they may mistake you to be having ulcers. We've also seen scenarios whereby these patients will present with swelling of the body, swelling of the feet, of the hands, of the face, or generalized puffiness that you could be presenting with. So it's very important that when you see some of these signs, that you don't take them for granted, that you really, really seek the right interventions. So pressure is something that we would hope most mothers to actually look out for. And of course, pressure can start right from about 5 months, especially the pressure caused by the pregnancy usually starts about 20 weeks and can even go up to 6 weeks after childbirth. So this is a complication that is very common, and it is one of the leading causes of death during pregnancy. In the event that this pressure is not controlled in time, it can give you more complications to the mother. For example, you could end up having the severe form of pressure called eclampsia, where the mother actually convulses or gets convulsions. or it could also result in what we call bleeding and clotting problems because of these uncontrolled pressures. But we've seen these effects on the unborn baby, where the baby struggles to grow in size. We've also seen where the baby sometimes is delivered prematurely, the placenta detaches early. We've also seen scenarios where there's a restriction in just the size of the baby in terms of growth. And we have seen some mothers losing their babies because of this uncontrolled pressure. So it's a very serious complication that all pregnant mothers should be aware of and look out for and make sure that they get timely interventions. The second complication during pregnancy is what is referred to as diabetes or gestational diabetes. So commonly, uh, your sugar levels should also be controlled naturally. Your body has got a mechanism, a system that is able to control your sugar levels during a pregnancy. However, when you are around the second trimester or the mid part of the pregnancy, there is a degree of insulin resistance that is developed, especially by the baby, so that it directs most of the glucose towards itself. So some mothers who have risks, what I mean by that, maybe they have a history of diabetes in the family, or the sugars have been borderline, almost towards the high end. Such mothers, those who are obese and all that, those mothers are at risk of actually developing gestational diabetes. And how does this present? Gestational diabetes presents with things like excessive thirst. You find that you're thirsty all the time. You're hungry all the time. You want to eat all the time. But also you find yourself going to pee most of the times. Could be in the night, could be in the daytime. So when you notice these three extremes of extreme hunger, extreme thirst, and extreme peeing, do not take that for granted, especially in the second trimester. If also you have had history of this before in the previous pregnancies, or you have it in the family, please discuss with your doctors so that they can be able to determine and measure your blood sugar levels right from the very beginning, or around the mid trimester. That's when they get to measure the sugar levels. So when they find out that your sugars are high, there is a confirmatory test that has to be done. This is called an OGTT. If this test confirms that your sugars are indeed high, then your doctor will be able to initiate or start you on treatment that should be able to control the sugars. Now, I must warn that this complication, if not handled, can result into another complication, like you've seen stillbirths. Most common stillbirths, especially the sudden stillbirths that occur towards the end of the pregnancy, are attributed to uncontrolled sugars. So make sure that these sugars are controlled. I know there are some patients, you will tell them you're going to start on treatment for diabetes, and then they will not be in favor of it. Unfortunately, if you do not control the sugars, the high sugar states will have an impact on the baby's well-being. And most times, these babies will deteriorate, and we've seen them struggling to grow. Sometimes these babies grow so fast that they're extremely big, and that can affect on how you're going to deliver this baby. But also we've seen these babies struggle, and most of them end up as stillbirths. We've also seen some of these babies getting convulsions after delivery because they've been used to a very high sugar state, and now after giving birth they are struggling to feed, their sugars drop, and some of them end up with convulsions and with brain complications. So this is a complication that as a pregnant mother you should be aware of, and make sure you inquire and talk to your doctors about it, especially if you see the three common symptoms that I spoke about. There are tests that can be done to confirm that, and then also there's intervention that can be done. The third complication that we look out for in pregnancy is anemia. Anemia is when your blood levels are low, all right? So, one, because every 3 months, you get to replace your red blood cells. But also number 2 is that the raw materials required for blood formation, the iron, the demands are higher during pregnancy, partly because the baby also needs the iron, but also you need the iron. So you get to really sort of share the iron between you and the baby. So that is why we give supplements to these expectant mothers to especially build the blood levels. We would like for your HB to be good, to be high, and we prefer for it to be even above 10. For women, we expect your blood levels to be between 11 to about 16. But if your blood levels are less than 10, that means you're anemic, your blood levels are low. Now, already that's a complication because it means that your baby is not going to get enough nutrients, so it's going to affect on the growth of the baby. It's going to give what we call intrauterine growth restriction. Baby is going to be restricted to grow. But we also see that this is going to affect how the baby is going to develop, the brain formation of this baby. And we have also seen that this is going to affect on how the pregnancy is going to progress. These mothers may end up with preterm delivery, premature babies that are being delivered, babies that are anemic at birth, and all these are complications that result to further complications. And again, the earlier that this is handled, the better. So this really goes out to women out there who do not like to be on supplements. Because when you don't get a supplementation, it means that you're putting your baby at risk of getting anemia and struggling to grow. But also you're putting your life at risk because if your blood levels are low and you give birth, certainly we expect you to bleed at the time of childbirth. So imagine your HB is at 6 or at 7 at the time of birth, and then you lose more blood during the time of birth. That is going to affect your life. We've seen such mothers end up having heart problems because the heart is struggling to pump the blood which is not there. So anemia is a complication that can result into further complications during the pregnancy, during the time of childbirth, that can actually be addressed by simple measures, just like taking folic acid and the iron supplementations during the pregnancy. So look out for this and try to avoid it. Discuss with your doctors to ensure that you do not have these complications. Then, of course, the other complications that we have spoken about during the pregnancy could be heart changes or heart diseases. So it's very important that not just pressure. You may find that you could have already developed a heart condition before the pregnancy, and the pregnancy tends to make that worse. It tends to worsen your heart disease or heart problem. So we've seen scenarios where the heart has to pump a lot of blood. Just because you're pregnant, your blood volume increases. And if that happens, it means that there is a lot more work for your heart to do. So some people can develop what we call cardiomyopathies or enlarged heart conditions. And if especially you've had a silent hole in the heart, a pregnancy tends to expose that and actually bring out the full symptoms of a heart problem. And of course, this can be presented with things like difficulty in breathing, difficulty, especially you getting palpitations. We've also seen you with such women getting swollen feet, swollen face, swollen hands, and such women get tired easily. When they walk a short distance, you find that they get so exhausted. So when you have such symptoms, it's very important for your doctor to be able to examine you and to make sure that to do the necessary tests. Sometimes we've had to do scans of the heart, known as the echoes, to just be sure that the heart is okay and doesn't have any disease process happening and going on. So those are the common ones that can happen during the pregnancy of an expectant mother. Now, during, of course, the time of childbirth, the common complications depend on how you have given birth. The commonest complications for mothers who have pushed vaginally are tears. Okay, we've seen those, we've said over 70%, 70 to 80% of women who have vaginal birth, especially first-time mothers, are prone to getting tears. And these tears could be as simple as the first degree tear, or it could be as extensive as a fourth degree tear. It's very important that these tears are handled in a timely manner by the qualified person to do that. Of course, if it's a first and second degree tear, your nurse or your midwife should be able to repair it. Third and fourth degree tears deserve to be repaired in theater by the specialist or the obstetrician or a doctor was been trained to really make repair of such tears. The other complication, of course, during the time of vaginal delivery, besides just tear, is yeah, the back pains, depending on the positions that you could have uh, positioned yourself during the time of childbirth. But these are minor complications. The major one is mostly the tears. Now, for cesarean section, there's a wide range of complications that can occur during cesarean section. And these cesarean section complications can range from just pain during the pain after the cesarean section. Now remember, if you are to undergo a cesarean section, you are definitely going to get a cut on your body, and that alone exposes you to more pain than someone who has not got a cut. But the pain should be controlled. Your doctors should be able to give you the right medications. And sometimes we've really seen scenarios where patients get extreme pain that almost does not respond to the medications that we actually give. And so we have to go a step higher and getting the anesthesiologist involved, to get the anesthesiologist involved, and also get the intensivists involved to actually control this kind of pain. The other likely complication after cesarean section is infections. And infections can arise either because of the surgery, if the sterility was not well done, or it can rise because of the hygiene or the wound care that has been taken care of after the cesarean section. So as doctors, we train, we teach, and we show the mothers what to do, how to take care of the wounds, to make sure that this wound does not get septic or does not get infected. Worst case scenario is when a mother gets an infection in the wound, and that can result into formation of pus and maybe passage of pus vaginally. Right. So again, this can happen for various reasons, not just the surgery alone, but also the recovery and also the other underlying medical conditions that the patient could be experiencing. The other common complications that occur after cesarean section is back pains, especially from the injection site that you've been given. Now, we don't expect you to have really persistent back pains, but depending on how the injection was given, how many attempts were made to put the spinal injection, uh, can actually determine how the mother experiences these back pains after the cesarean section. So we've looked at pain, we've looked at infections, we've looked at back injuries or back pains after the or during the cesarean sections. Other complications could be just reactions to the drugs during the cesarean section. Some mothers can react to the drugs that are being used. We've seen mothers get what we call high spinal, where the drug used for the anesthesia goes beyond the point we want it to go, and it decides to actually affect other systems in the body. Such mothers can actually end up having difficulty in breathing. Others may even become unconscious during the time of cesarean section. But all this is well watched over, and of course, there are interventions to make sure that this is well controlled. Yeah, so those are the complications that you as a mother should look out for, should discuss with your doctor uh, during your time of care, during the antenatal journey, during the time of childbirth. Thank you very much for listening, and I hope to catch you again on another episode. Don't forget to like, subscribe, and share.